welcome to the Kelly Roach Show, a place for no fluff, easy to implement, 20-minute or less business and leadership lessons to help you build a sustainable business that scales. Let's get started. All right, welcome back to the Kelly Roach Show. We have an amazing guest today, Laura Katz, who is the founder of Helaina, a company that has disrupted the breastfeeding milk industry. We're going to talk today about the scientific breakthrough of reproducing the proteins found in breast milk. And there are so many women out there. When I read your bio, there are so many women out there that want to breastfeed desperately but can't. And their babies are not getting the same nutrition found in breast milk, right? And so this is absolutely going to change so many lives and enhance so many children's health and well-being, and also give, I think, such heart security, I think, to so many moms out there that may not be able to breastfeed. So Laura, tell us a little bit about how this journey began, how you got going with this journey, and a little bit about where you are today with Helaina.
Absolutely. Thanks so much, Kelly. I think exactly what you just said is what we're trying to do at Helaina, is to empower and help the parents or caregivers who are looking to feed their babies breast milk and either can't or choose not to. And so to be able to bridge the gap between breast milk and infant formula with the thing that we care about the most from breast milk, or that we think about a lot, is the immunity, is what we're focused on. But our backstory at Helaina and how we got started was myself being really curious as a food scientist and new technologies pouring into alternative milk and alternative meat and all of these products, really seeing innovation. I saw this category really sitting behind, and it's such a critical space to innovate in, because feeding babies is where nutrition starts. It's where all of our journeys as people start. So making sure that we can bring the most advanced products to babies is something I, at the beginning, thought was really critical, and of course, still to this day. And I was listening to a podcast on the black market for breast milk. This was probably 6 or 7 years ago. And I learned that parents in the US would go on the internet to buy breast milk from strangers and spend a lot of money doing that. And their why behind this decision was that they wanted to be able to provide their babies with breast milk, but they couldn't themselves. And they didn't feel like infant formula on the market could provide the same immunity that breast milk can. And hearing these parent stories on this podcast, the lengths that they would go, and knowing from my background in food science all that we were seeing in alternative meat and dairy, I was like, well, there is a solution. Somebody just has to go do it. So that was the idea for Helaina, was to take this technology and channel it towards making components of breast milk. And that's, now 6 years later. It took me a few years to be able to start the business, save money so I could quit my day job. I've been doing this for 3 years, but now on this path forward, we realized that making proteins from breast milk isn't just valuable for babies, but for the immune system across the life cycle, from early life nutrition to end of life nutrition. So we're really starting to think about making our first product infant formula, but how we can improve immunity across different demographics.
Yeah, absolutely. And it sounds like you're not the only one that sees the importance of this and is getting behind it. So you guys have had massive support. I know you've done fundraising and you've had investors and, gotten a lot of people on board with this. Talk to me a little bit about that process of spreading the word.
When we first started fundraising, it was myself at my kitchen table in the Lower East Side in New York City. And I didn't know anything about fundraising. What I learned very quickly was that what we're working on and we're really trying to achieve is so personal to so many people, because most people understand the challenges that parents face if they're a parent or there is a parent in their life. So the message that we've been able to share with investors has been something that really resonates personally. And I think for our fundraising journey, that's been really powerful, is showing people how personal this is. So we've raised multiple rounds of funding so far. And as we grow Helaina and we get closer to the vision of what we're trying to build, I think it becomes even more accessible to people on what we're trying to build. And with fundraising, at the end of the day, we're working with people, and everybody wants to be able to put money behind something that they think is going to make a big difference in somebody else's life. So we've had a really successful funding journey so far.
And so you said you're 6 years in. Is that right? You're 6 years in now?
3 years into Helaina as a business, 6 years in for me personally on this whole path. But the early days of Helaina, as in me by myself, just calling other entrepreneurs, trying to figure out what to do, was, me saving money so I could quit my day job, because starting a business is very expensive. So it took me a few years to do that.
Yeah, absolutely. And did you know from the beginning that you were going to seek investors and raise capital to really, bring this global? Or like, what was your vision like as you were starting to realize, what the possibilities were with this?
The vision from the very beginning was to, and still is, to improve nutrition for as many people as we can in a sustainable way, and through a definition of nutrition that I don't think anybody thinks about. Right now, we think about nutrition being calories, vitamins, and minerals, but it's really much broader than that, and helping to boost the immune system or nourish the immune system is what we've always wanted to do. We want to get global and help as many people as we can. And when I first started fundraising, not knowing I didn't know what a venture capitalist was at the time. And so I had cold emailed angel investors, just purely, I didn't know anybody. I was just cold emailing. And I ended up meeting somebody who's now my mentor, who said to me, if you could do whatever you wanted to do and capital didn't matter, what would that look like? And, I painted this whole vision, and he said to me, well, we'll figure out how to raise the money. You need to go after what you really want to do, because it can have so much scale. So the vision has been quite big from the beginning, and raising money has been kind of a consequence of that. We know we need a lot of capital to build this technology. Putting a new infant formula on the market, as we're seeing with the environment right now, requires a lot of safety work, a lot of checks and balances to make sure that what we're bringing is the most safe and efficacious as possible. So that's not easy, and it requires so much work, many years. So we've always known that it's a capital intensive business, and we just have to do what we need to do to make sure that we can continue to secure the capital to get to the milestones and eventually launch a product.
Do you have a target date as of now for the product hitting the market?
As soon as we can is the target date. It really, our timing changes quite frequently with the current landscape. So the FDA is constantly now putting out new regulation on this market, given everything that's happened. So we're following that closely, and our focus is safety. The first thing that we have to do is ensure safety. So as we do a lot of the studies that we're working on, and working with our manufacturing partner, we'll have a clear indication of timing. And I think things are very fluid right now, because everybody is so concerned on keeping the supply here available and safe.
Yeah, no, makes sense. So talk to me a little bit about, for both you and for the team, holding the vision, over a period of years, knowing that, number one, it's, not a straight line, and the regulations are changing all the time. And every time you make it to the next milestone, obviously new things are going to pop up that then you have to work through and address before, ultimately getting a product to market. So I think one of the biggest things that entrepreneurs struggle with, and especially leaders, is, sustaining that long-term vision over a period of years without being able to hold in your hand, the win, the end product, the success, the results. So talk to me a little bit about that journey for you.
I don't think it's easy you have to really have such a clear vision of what that looks like. Like, I will have dreams of seeing our product, like at night, seeing our product on a shelf. And to me, it's a very real future. And so I think as an entrepreneur, part of my job is to be incredibly optimistic and motivating. And I'm one of those people who truly believe so much can happen. Plenty of people have, especially at the beginning, were like, well, you can't get into this industry. It's dominated by a few people. It's incredibly expensive and time consuming, and it's a lot. It's an uphill battle. And so that doesn't scare me. But I think for a whole team of people who need that constant motivation and clarity on what that next milestone looks like and how we get there, it's just constantly top of mind that we need to always be getting people excited about what Helaina will do for people, for parents, for babies, and bringing that messaging into as many meetings as we can. Yeah. We do monthly all hands where like at the beginning, I'll always frame it with like, here's what we're working on. Nobody's done this before.
Yeah.
There is not a single company that's put human proteins into food. Mm-hmm. And it's hard, mm-hmm. but the hard things are worth doing. And I think it's also finding people who aren't afraid of those types of challenges of like truly hard work, because it will pay off. So I don't know if that's a great answer to your question, but I think it's just like incredible optimism and getting excited about what you do every day.
Yeah. Yeah, absolutely. What do you feel like have been some of like the hardest lessons learned or most important lessons learned, as you've identified new roadblocks or things that you needed to overcome or, kind of pass through some of those challenging seasons with Helaina?
Most challenging obstacles at Helaina for me, I'm just thinking there's been so many. It's always challenging when we hear a timeline gets pushed back. You want to move as quickly as possible. And that's something that we're trying to do every day. And then you get used to learning those hurdles. I think something that's really challenging for me is when something happens with our team. Somebody, decides to move on, or there's a conflict on the team, because we're only as good as the team, and building a culture where people love the environment and feel really motivated by the mission is exactly what we're trying to do. And I think everybody's been in a work environment where they haven't had the best experience. And that's always in my mind of how do we create the best environment for the team, the most accommodating, the best culture. And so that's really difficult to control. And any little thing that happens, I'm up at night. I can't sleep if I think something's going on with somebody on the team, if somebody feels something's wrong at the company. It's so hard to avoid those things. Everything's going to happen. And so that has been the most challenging part for me.
Yeah. Yeah. When you think about disrupting the industry, I think a lot of industries are that way. Like, I mean, this industry in particular has not been disrupted really. Has it ever been? I mean, I don't know. The infant formula industry, I mean, it's kind of been what it's been since its inception, right? So like, this is the first major disruption in this space. And I'm sure there's a lot of people that aren't real excited about that disruption, and coming and what it means for the rest of the industry. How have you navigated that?
I would say the big players are aware that innovation is coming, and I think that they will eventually welcome it. I don't think it's going to be easy for us. At the end of the day, we have to build trust with consumers, and that is a really long process. It's not easy to build trust, especially with parents who they have so many decisions to make. They are so concerned about their child because they're a baby, and you can't communicate with a baby. I'm learning this right now, and you just want to make sure that you're giving them the best. And for us, the challenge on entering this industry is, I would say, less about the competition and more about creating that relationship with parents, that they, can come to Helaina and feel supported and feel like this product isn't just, an infant formula that hasn't changed in 30, 40 years, but it really is something that will improve the health outcomes of their babies better than the current product, and more similarly to breast milk.
Yeah. And so when you look at building that trust with consumers, because I think this is a really important conversation, when you look at building that trust with consumers, are you actively like engaging with the market now? Or are you building the brand? What are you doing in advance of the product being released to infiltrate the market and to build that trust with parents and have the name known before the product is released?
So that is exactly what I would say, starting to do. When we started the company, the focus was, let's figure out how to build this technology first, because without this, we can't move anything forward. And now that we've done that and we're scaling and we're working through regulatory activities, we're starting to think about how do we connect with parents. But it's not just parents, it's doctors, it's thought leaders in the space. And we are starting to build those relationships because we want to be able to show parents and doctors and anybody, caregivers generally, that our product is going to have similarities to breast milk in the immunity properties it will have. And so starting these early relationships by sharing what we're working on with doctors and experts in the field, it's, showing them papers that we're working on and showing them the data that we're collecting and really just bringing them along the journey, because no one's going to trust our product if we just put it on a shelf tomorrow and they've never heard of who we are. And we don't want that either. We want people to have that relationship with us throughout the way. So I would say we're figuring out what that looks like with parents, because they have so many things that come their way. We don't want to just be more noise. We want to be helpful if we can. But with the clinical side of what we're doing, those are things that we're actively working on, and also getting input and feedback. Because we can think we know what the best product is, but when you talk to pediatricians and you talk to neonatologists, you can learn so much from them on what they see parents are looking for.
Mm-hmm, mm-hmm. And, just like for the education of everyone listening, like when you look at the health of a baby and the distinction and the difference between a baby that's breastfed and is getting that immunity support and those nutrients and all of that versus, the formulas of today that do not have those components, what do you think the material impact on the health of a child that, is going to have this particular, the Helaina formula from day one? Like, what do you think that the definitive impact on health will be for those children?
That's exactly what we're working on right now. So we are recreating the proteins in breast milk. And these proteins, the way they function in babies' guts and in our body generally is they act as antimicrobial agents. So they basically teach our bodies how to fight microbes, how to fight against infection. And in breastfed babies, that's something that can help to develop their immune system, because you learn how to fight against things that come your way. So as we develop Helaina's proteins and our ultimate final product, our first product, infant formula, that's exactly what we're testing for. How do these proteins function similarly to breast milk, and will they help to reduce infection or reduce, any type of immune response by the body as the baby develops? So we're working on it is the answer, but that's what we're ultimately working towards.
Okay, great. No, it's fascinating. And how do you test?
How do we test? So there's so many different ways that we can test. In our lab here in New York City, we've got an immunology team. We have at this point, maybe 30 or more scientists that test all different parts of the process. So we can test really easy tests on our protein. Is it binding to the right, materials like it does in the gut? We are basically simulating the gut microbiome in our lab, so we can see how our protein in test tubes essentially starts to break down, and our proteins break down in our stomach, and we want this to break down exactly how the breast milk version does. So we do all of those tests in lab to see not just is it the same structure, but as we eat it, is it doing the same things in our stomach? So that's something that we're testing. And ultimately, as any infant formula company does, we will need to do clinical studies. And that's what we're planning for right now. So for clinical studies, we can measure things like growth, is the baby gaining weight properly and getting longer, and what does that look like? But we can also look at the immune system. So we're going to be looking at different antibodies. We can test for inflammation. We're testing all of these different things so that we really can see how our product compares to breast milk. And we'll be testing the same thing in breast milk as well.
Yeah. Beautiful. It's fascinating. And when you look at the way that it will be priced in the market, do you expect to price it similarly to the majority of competitors? Will it be on the higher end? Will it be completely priced differently than a lot of what's on the market? Like, what is your vision?
We don't want to be premium. Premium products, while they serve a purpose, aren't accessible to everybody. And while we probably won't be accessible to every single parent, we're all in different socioeconomic states as it is. We want to be as accessible as possible. So we will be at price parity to, I would say, that like a mid-price product. That's starting to change because infant formula prices have gone up 30 to 40% in the last 8 months. So things are getting really expensive, but with the current manufacturing practices that we have right now and all of the inputs and how it's priced out, we will be at parity with the conventional brands, which is such a big part of our vision. We want to be accessible and have these health impacts touch as many people as possible.
That's amazing. That's great. Well, I think it's incredible work that you're doing, and it takes a massive vision and a lot of patience and a lot of diligence and just a lot of ingenuity to not just have the vision and the idea, but to follow it through. So massive congratulations to you, and definitely rooting for you to make it to the finish line. Absolutely. So just anywhere, number one, that you want people to check out what you're doing and see what Helaina is all about. And number two, just parting words for the entrepreneurs that are just discovering you for the first time today.
Following Helaina, I would say check out our website, helaina.com. We are in the process of building out social channels, so those are to come. Parting words for entrepreneurs, kind of what you just said, it takes a lot of patience. You're not going to have a $1 billion business next year. That's not possible. But if you see that 10-year plan or 15-year plan and know the work that it takes, which is hard, it's not easy. There's a lot of sleepless nights, but that's the process. And if you feel really passionate about something and that's something you imagine yourself doing day in and day out, you should pursue it. I think something that I talk to a lot of entrepreneurs about is just the day that you have to live every day. You need to love what you do because you only live this life once, and you don't want to be regretting what your job is and how you're spending your time because we only have so much time. So do the thing you love. And if you can do that for as long as you can, it will be successful.
That's it. That's it. I love it. Well, congratulations. Thank you so much, Laura, for everything that you shared on the show today, and wishing you absolute best of luck taking the product to market.
Thanks so much, Kelly.